Hello, everybody. I am Dr. Rahi Victory. You are watching Fertility Fact or Fiction, our weekly show where we bring to you the latest and greatest in the fertility world. And sometimes we bring you guests. And tonight we have a guest. We have a special guest who is coming to us all the way from the Ottawa environment. And she is very popular on Instagram and has created quite a following with her own baby journey. And so she wanted to share with us a little bit of information because I know her and she had a very unique journey. And on top of that, she recently was talking about delivery. And when she started talking about an induction, she got the usual hate mail that many people do with a whole load of misinformation. And since that's something that is very near and dear to me, we have a great video on it on YouTube. I thought, you know what, better way to start answering some of these questions than to bring her on the show. So without any further ado, I would like to introduce you all to Sabrina DeLellis, who is our guest tonight on the show. So Sabrina, welcome.
Hi.
Hi, how are you doing?
I'm good. How are you?
I'm very well. So thank you so much for joining us. We appreciate it. Lovely to have you here. And I really appreciate the willingness to jump on and share with us some of your personal experiences in your journey and talking to us about what made it good and what made it bad. And then of course, I really want to spend a lot of time talking about how the pregnancy has been for you, because we spend a ton of time helping people get pregnant. But then they forget that there's this whole other 9 months to the journey where they have to be pregnant. And so you've experienced both ends of that now. So I think it's great to kind of have you on the show and talk about all that.
Yeah, I'm excited to be here. I've been watching your show for years now, so it's kind of neat to be here. So thank you for having me. So I'm definitely excited to share the journey that I took to get here. I saw it, and then this pinch me moment where I can't believe I'm actually 28 weeks today. Very
Wow.
grateful for, yeah, like third trimester finally. Like it's pretty amazing.
Yeah, that's incredible. Good stuff. Did you do your sugar test now?
I did. I passed with flying colors.
Excellent. Well done. Very good. Very good. Yeah, we often find that after all the strictness of diet and exercise and everything that our patients go through to get pregnant, once they're pregnant, they kind of cut loose a little bit and then they'll fail their first sugar test. So it's great to see that you did all the right things and you passed. So that's good. A lot less hassle when you don't have to deal with the diabetes for sure.
Well, it was right after the holidays too, so I kind of was joking that I've been prepping for this test. But my score was well below kind of what they were looking for to even get me to the second test, so we are good on that front.
Awesome.
Yeah.
So tell me a little bit about your fertility journey. Kind of walk us through what, obviously within the bounds of what you're comfortable with. But tell us a little bit about your fertility journey and sort of what steps you went through to get to where you are today.
So it started in 2019. I was 32 at the time. I'm trying to give you the Coles notes because this otherwise we'll be here for a few hours. But essentially, it was at the end of 2019, and I just felt that something might be not right, even just before trying to conceive, because I had always had really bad period cramps. I had had hospital visits for what they just told me was like normal ovulation pain and this and that. So I got to my family doctor and I just said, can we just do a few tests here and there just to make sure things are okay? And then he was like, you're fine, you're young, you don't have endometriosis, all that. And I was like, can we please just do, an ultrasound, something? I've been spotting also, which doesn't seem quite right. Anyways, so after pushing for that, I had an ultrasound, and then it was the technician who actually looked at me and said, what is your doctor doing about your endometrioma? And I said, I was like, what do you mean? She's like, well, you have endometriosis. And I was like, no, I don't. Completely shocked because I had been told time and time again that I did not have endometriosis, even though I had pretty much all of the symptoms for years since I was a teenager. So that's how I found out I had endometriosis. I was referred to a gynecologist pretty early on, and this was at the beginning of the pandemic. And she pretty much told me that I should be seeing a fertility doctor right away, just because of the size of the endometrioma and how it likely indicated that I had advanced endometriosis. So I did that at the fertility clinic here in Ottawa. I didn't know much about like endo or fertility issues at the time, so kind of learning as I went.
As you go,
Um,
and your resource was the internet and reading and blogs and stuff like that?
yeah, and so I had started following some people going through journeys because I had a friend that had gone through IVF, and so I was very still new to it, kind of putting all my trust in, obviously the doctor that was there. And I remember one of the first things she said to me was, "We don't do anything for endometriosis. IVF will bypass that." And I thought, I don't think that that's true, because I had heard like that's not quite correct, but I was like, okay. And then the second red flag with me at that clinic was that, I don't know if you remember this, but my ovaries like to hide. They're a little bit, high, and they're hard to access. And essentially, she just kept getting me to come in and in and in, and then just being like, "I don't know if we'll be able to access your ovaries." And I have low AMH, so I don't have a lot of eggs to begin with. Um, and it wasn't until I found out that you can actually do retrieval through your abdomen or whatever it is to access that. So I kind of asked her about it. I was like, "Can we do that?" She goes, "Well, some doctors can, but we can't do that here." And I was like, "Well, why didn't you tell me?" Right? Like, why have I been wasting 8 months at this clinic when I could have been referred elsewhere? And I'll never forget
That
this.
time when your AMH is low and you're nervous and you're anxious and you're dealing with endo for sure.
I will never forget this, but I asked her, "Why didn't you tell me?" And her response was, "Well, if we told everyone, then we would be losing patients and they would go elsewhere." And I was like, like, it just so insane to me. So that was kind of the last interaction that I had at the clinic here in
Oh my
Ottawa. And then
God.
I moved to the Toronto clinic, to one of the Toronto clinics that had, pretty good success rates. I wasn't so lucky there, but I did manage to do um, two, three, no, two egg retrievals there, and tested the embryos. So they were euploid, they were like good grades, like 5AA, 4ABs. Granted, the two first were day sixes, but day fives and day sixes aren't a huge, success rate difference. But I had failed implantation for both of those, which was obviously very devastating when you don't have many embryos at all, right? So I remember asking the doctor at the time, "Can we do more testing? Can we test to see if I have high natural killer cells, or more immune stuff? Can we do blood clotting?" And then it was more met with, "It's just a bunch of hocus pocus. There's no reason to really do any of that. Just keep transferring." And I was like, I don't know what to do, right? Like, you're putting trust in a doctor, trust in this clinic that has pretty good success rates. You're just like, okay, maybe it's just me. Like, I don't know. I didn't know better, I guess. I mean, I was trying to advocate for myself, but also kind of at the mercy of what I was being told. So I did one last transfer there. Um, our lowest embryos, they were 2-day sevens tested. Sure enough, after I think I had started following you actually at the time. So I learned about the Lupron, the endo protocol, and then I insisted on at least getting some um, prednisone, just something, like give me something different. And that was after like me begging and begging for it, but he refused to do any other testing. Anyways, so implemented a little bit of changes, and the embryo did stick, but unfortunately at our first ultrasound, so right before the 7-week mark, we found out that we had a blighted ovum. So that was, of course, really devastating. But we just kept holding on to hope that we would be able to get there. And that's when I had messaged your clinic. And, I still remember, I think it was probably a Saturday or Sunday evening that Curtis and I hopped onto a call with you.
Yeah.
Yeah. I think football was on. And anyways, and then I remember looking at him after we had a conversation, and I said, I feel it in my gut, like it's going to work, And it was so different from anything else that I had experienced. But I'm like, he's actually listening. He has a plan. Like, I'm not crazy. We can make this work. And that was the one time I looked at him and I said, if we can get a normal embryo, I think we've got this.
Yeah,
So,
that's awesome. I'm glad we
mhm.
could be a part of that. What do you think that the key differences were between what you were experiencing before and then what you experienced from us? Do you think it was mostly just that I listen or that my team listens, or was it just kind of an overall difference in approach, or did you feel like you were kind of being pushed by the others, whereas this was more collaborative? Because that's really sort of what we aim for. I mean, obviously we want to guide our patients and having the knowledge and the skills, that's part of what I have to do, but at the same time we always want it to feel collaborative so the patients know that we are listening to what they're telling us and we are hearing what they say and we value their input and want them to have options and choices.
Yeah, definitely think it was a little bit of everything. Just from, I mean, what I really appreciated with you is that whenever you would present something, you were able to back it up with science or tell me why, a certain approach you felt worked. Whereas before, if I would ask it, I wasn't really met with any kind of concrete, this is why, rather than this is just what we've been doing, and no, we're not going to do anything else. So I felt that with every step of the way, even though, like, of course, mine was like very long, where we had to do um, the 3 months to lead up to try to wake my ovaries up and to create better quality. We had to do the 3 months of loop on this, and that's what took a long time. And we weren't rushing it, so I felt like we really catered to all of the needs that would allow for success. And I didn't feel like you were rushing me to like do things just to get a transfer in. I mean, from when we met to when we transferred, it was pretty much 12 months, right? So we didn't rush anything. We really made sure to do all the testing, get the testing back, figure out, make a plan of action. And I'm sure you realized really early on that I have a lot of questions and I like to understand why we do a certain thing. So I think just having the patience and not feeling like I'm a burden, or like that I thought was really good in that sense. I felt like I was able to talk and to be heard and to answer questions without it feeling like I'm just another number.
It's a fine line for us because I fully recognize the anxiety and the panic that comes with the diagnosis of infertility, especially for women who either have lower AMH or they're older, because there is so much anxiety and there's so much strain and stress. And there's this, biological clock that's very loudly ticking, unfortunately. And that's what they're hearing. And so any delay often represents even worsened stress and higher levels of strain and anxiety. At the same time, I always tell, pretty much everybody, and we use this line on the show all the time, that, rushing fertility is a really good way to make your fertility doctor rich and make you poor. It just doesn't work because we're ignoring the nuances, we're ignoring the details, we're probably not listening to you, which we really need to do to achieve success. And so there is this fine line between trying to be efficient and get things done in a reasonable time frame and at the same time make sure you do them right. And I'm always willing to err a little more on the side of caution because I never want somebody to come back and then say, well, why didn't you take the extra month? It wouldn't have made a difference. And we know certainly from research that even a 6 month delay for someone with diminished ovarian reserve actually has no impact on their outcome. So I feel kind of comfortable saying, look, let's take our time. Let's make sure we understand your physiology, your body, your story, and kind of custom tailor what we're doing to you. So I appreciate that feedback. Was there a way you dealt with that anxiety during that time period? Like, was it just feeling comfortable that helped you get through it, or were you exercising or yoga or meditation, or what were your tricks to get through?
Oh gosh, so many things. For me personally, I like to have a plan, right? So if I know what's coming up, it really helps ease my mind. What is most difficult for me is the unknown. So if I don't know what's happening kind of in that in between, that's where I get more anxious. But with us, I knew that it was going to be a long process, but I kind of knew the steps ahead. So I was able to at least have these countdowns and whatever it is, focus on doing a lot of hikes and talking with others, going for walks. Like for me, moving my body really helps with anxiety, or journaling, documenting everything that we've gone through to me is a way to express and let out everything that I'm feeling, and also help me connect with other people who are going through similar paths, right? So that's kind of how I dealt with the anxiety. I mean, having said that, I don't know that I've always done it at, always been great at it. Infertility is kind of a beast, right? So it's continuous even now. Sometimes I still have hard days, but it's knowing that, it will get better, and this is just one day in my journey. So.
Now, how'd you get into the social media part of this? Because obviously you have a huge following now. Congratulations. I think that's awesome. And so what was it, just the desire to have that ability to kind of pour your thoughts and your feelings into something that you could share, or were you doing it ahead of time? Like, how did you get to where you are now in that part of things?
Yeah, I had a friend who I had started. So I had started following a few accounts on another Instagram, like a personal one. But I was doing it more secretly. I didn't really want people to know what I was going through at the time. I wasn't ready to really talk about it, so I was doing it more secretly. And then my friend Amanda had shared about her journey, and she was the one who had recommended that I join different support groups and start, doing this and that. And so what I had done originally is create an account, so the account that I have now, but I kept it private. And I never showed my face. Even the pictures, if you scroll all the way down, you'll see that I never showed my face in any of them. I really did not want people in real life to find out what was going on. A lot of it was because I didn't know how common it was, and I didn't know anyone else that was going through it. But as I started making connections with others, I realized how many people were going through similar paths, and how I really wanted to use my voice and create this community. And it kind of just happened. The more and more I shared, the more I realized that a lot of other people were going through very similar journeys. And I don't know how I got to where I am, but I'm so grateful for this community and the friendships that I've made along the way.
Yeah, and I know you're inspiring tons of people because you do great work. Your posts are awesome. They're super warm and very inviting. And even for me as the physician, I'm like, wow, these are like really endearing, touching moments. In particular, I will admit I did tear up when you had your positive
Mm.
because that was such a great video, the way you guys did that. It was so sweet. And I felt so invested in your process that when I watched that, I was totally tearing up. So that was awesome to see, and incredible for you to share with everybody. And I know for many people it's triggering, but I think in your particular journey, because you had gone through so many hardships to get to that, BFP, the big fat positive, it was pretty
Mhm.
awesome that you got that opportunity to share that, and what a great story and a great moment. And I think a lot of people have taken inspiration because people keep contacting me telling me they've spoken to you, and then and now they want to see us because of it. So it's really inspiring a lot of people, and I think helping a lot of people to cope with the ups and downs of their own journey and what they've gone through, because I think it really provides that outlet. It's very cathartic for a lot of people.
Well, it certainly means a lot to me, to hear that, so thank you. And I think really what I've also tried to do is keep it real, in the sense that it hasn't always been these, beautiful, amazing moments that are inspiring, but also there are moments where I've really been at my lowest. But I've used it in a way to just really share the realities of what I'm going through. So I always say, like, I share the good, the bad, and the ugly. And that's something that I've done. I think that's where other people have also said that they're able to relate, right? Because you can make your social media account however you want to make it look like it's all pretty and all great and exciting and this and that, but the reality is I will never say IVF is exciting. Like, it's not. Of course, being in a position where you're able to be pregnant and bring home a baby, that's exciting, but the process, the needles, the constant, appointments, this and that, that part isn't exciting. Um, so it's really just sharing the realities that go behind a journey like this.
If you could give a message to people who are struggling in their journey, what would it be? If you could kind of caption it all in one phrase or one sentence, what would you share with everybody as far as, what they should do as they go through their own story?
Yeah, I'd say hold on to hope. Remember why you're doing what you're doing. So for me, hope was the biggest thing that kept us going, even when I felt that I was unsure where we would be, or if this would ever happen. I just kept holding on to that. But mostly is to advocate for yourself. That's my biggest advice for anyone. If you're not sure about something, if you have questions, ask them. Make sure that the person, the team that you're paying for, right? Your doctor, the nurses, everyone, that they're actually able to provide the service that you're looking for. So don't just settle. And certainly, if something doesn't feel right, speak up. If you have endo, definitely talk to an endo specialist and not just an OBGYN or a gyno, all that stuff. So just really trust your gut and hold on to hope.
Well, that's great. I definitely think that from my perspective as the fertility physician, I feel, as you know, very passionately that we need to advocate for our patients. And I hate the fact that patients feel like they need to advocate for themselves because I feel like as a profession, we're really failing patients if they're coming to us feeling like they need to advocate for themselves. I mean, my job is to heal infertility, to cure infertility, to solve the problem of having a family for people. And that means I need to exhaust all my knowledge, all my skills, all my abilities to facilitate that for people. And if someone's coming in saying, well, you're not doing enough, you should be doing more, then I failed them. And I don't think that's fair to patients for us to be failing them. I mean, it makes no sense, right? We shouldn't be failing patients. But it's actually very often precisely what's happening out there. And I have to say, I'm very proud of our team because we try very, very hard to avoid that. And I see that all the time. I mean, a huge part of what I deal with every day is talking to people who say that their fertility clinic isn't listening. They have endo and they're being told exactly what you were, which is honestly laughable, which is endo doesn't matter. IVF will overcome endo. I mean, there are hundreds of studies which prove that that's not the case. And so it takes a lot for a fertility specialist to be invested enough to do it. But at the same time, I think that's the job you signed up for. Like that's what I agreed to when I took on this task. And I wish there were more specialists out there. And there are some. I'm certainly not the only one that feels the way I do. But I think it's a fairly limited pool of fertility specialists out there that are super invested in being the advocate for their patients so that you don't need to. Because at the end of the day, you're a highly intelligent person. You have studied, you got onto the blogs, you got onto the, pages, you did your research, you came, educated and knowledgeable. But a lot of people don't have that ability or the time even to do that. And really, ultimately, they're putting all their faith in our hands. And if we're not serving them the way we should be, that's a failure on us. And I take that really personally. So I do hope, my message to everyone out there is the same thing. Like I wrote it the other day in one of our posts, but if you're not getting the care you need, jump ship. Like that is the superpower most patients don't realize that they have. The fertility clinics don't have to do what you want to do, but you have the ability to leave. And that's the one thing they are terrified of because the minute you go somewhere else, A, it looks bad for them, and B, they're losing money.
Yeah.
And so your superpowers as patients out there is to have choice. And that choice is make sure that the clinic you're going to is treating you the way you should be treated. At least that's the way I feel about it. I don't know if that resonates with everyone out there, but
And yeah, and I mean, I think that's great that you say that. And for me, where I really noticed it was with my first clinic, how I really and I had asked to get a referral to an amazing endosurgeon, Dr. Singh here in Ottawa. After doing a lot of research and finding out that he is highly recommended, and I had asked her for a referral to go and see him because I had so much pain. I really wanted to make sure to also not just address my fertility issues, but also address my pain, my day to day life.
right.
And I could tell that she really wasn't, it's almost like she just didn't care to address that. It was, let's focus on your fertility and ignore everything else. And you're not really kind of addressing the whole issue. And for those who don't know, I had, what was supposed to be a 2 hour surgery turned into 4.5 hours. It was way worse than Dr. Singh had anticipated. Endometriosis was found everywhere, all the way up to my diaphragm. And within 5 minutes of waking up from that surgery, Dr. Singh looked at me, and this was during the pandemic, so I was alone and very, very drugged up. But I remember he told me that my bowels were so twisted that I would need to go for an urgent, I think, CT scan with contrast and stuff because they weren't sure whether or not I had a blockage, and they hadn't been prepared to have the other surgeon in there to do a bowel resection if we needed it. And I guess I had to sign forms. But within 5 minutes of waking up from that 4.5 hour surgery, I found out that I would need a bowel resection. Right? So it's not just, okay, you have endo, we'll just do IVF, but what about it actually addressing what the issue is? And sometimes that is the surgery or whatever, right? So and it always makes me very sad for people who are just told it's not a big deal, when I'm like, well, my bowels could have been life threatening at that point, right? They didn't know
Yeah.
how bad it was, and it's that's scary. And for a doctor to just ignore it and say it's nothing, and for me to have gone to the hospital, talked to so many doctors, asked for this, and said it's nothing, you're fine, you know, it's in your head or this and that. It's really awful to have gone through that, years and years of being dismissed.
Yeah, and it is a horrible thing. I mean, I know there's a British study that showed that the average in the UK to get a diagnosis of endo is 7 years. And I mean, it shows that there's flaws in the system, but ultimately, at the end of the day, it's not really hard to suspect endo. Diagnosing it's a different issue, but suspecting it is quite easy. And it's amazing how many people are ignored or the symptoms are downplayed because it's being done by either gynecologists who are too busy, or they just think pain is normal, or conversely, it's at a fertility center where they're prioritizing getting you into treatment. And, it's terrible to say, but it's reality because there's a financial motivation to do so. And so that often is a huge disservice to patients. And I think it's critical for us to actually take that part of things very seriously. I always offer patients that have unexplained infertility, or if I know they have endo, I'm talking to them about surgery. I certainly never force anyone to go through surgery because it is a serious choice. It's got consequences. It doesn't always go well. And so people have to be prepared for the repercussions. But at the same time, to ignore it or to devalue it, or to tell the patient it's all in your head, which quite frankly is crazy to say to anybody. You're almost surely going to get a complaint to the College of Physicians and Surgeons of Ontario for saying something like that. It just doesn't make any sense. I mean, we are way past that day and age where the doctors can sort of talk down to patients and belittle their symptoms, or not think about them in a more serious fashion, or take them in a more serious fashion. So, I'm glad you got the care you need. Sony was actually my junior resident, so I know him very well, and he went on to become a spectacular surgeon. So you did indeed get the best, which is amazing. That's so good. I'm happy that he was able to do that. Tell me a little bit about your pregnancy. I know, now that you're pregnant, tell us about what your first trimester was like, and what your second trimester has been like, and then let's rear the head of that induction dragon, and
Sure.
see how
Yeah.
that sits
The
with
first,
people.
yeah. First trimester was definitely snail's pace and very anxiety inducing for me. I had the initial excitement, of course, we have a positive, the first beta started off strong. I felt really good. And then betas were a little wonky and, things looked good. So I had a lot of anxiety there. I was just really scared of having another blighted ovum or having something happen early on, especially having had not really any signs when I had my miscarriage earlier on,
Right.
kind of going in there blind. So the first scan, I had so much anxiety going in.
For sure.
It was awful, honestly. I was like, maybe we just don't go. Let's just skip this. Just pretend that everything is okay, right?
Yeah.
And then it was just the most amazing moment, just seeing, his heart flicker on the screen. I never experienced that, so that's pretty neat. So then I went through. I feel good. I can breathe for a few days, and then again, of course, that anxiety kicks in when I'm just a few days away from that scan. Get the sweaty palms, the anxiety, all that.
Yeah.
Uh, and then everyone would tell me, "Oh my gosh, it's going by so fast." And I remember being like, "Oh, I'm sure it is for you," but no, it was awful. And I forget this part, but I was also on um, prednisone, and to me, prednisone, although I'm super thankful that I was on it, made me very grumpy, and I'm not a grumpy person. So it was kind of balancing those hormones and pregnancy and anxiety and feeling puffy. My face, I had the moon face, my hands were swollen. I just didn't feel amazing. I mean, it masked all of my pregnancy symptoms, but didn't feel great. So first trimester, I was super happy to get through it. It was a huge milestone. Second one is when I weaned off of the prednisone and whatnot, and that's when some symptoms started to come on. So the nausea. I did have one day of puking, but a lot of nausea in the evenings. Tired, so tired. Slept a
Wow.
lot, enjoyed my naps, they were great. And then it's gone by really fast now. And I think that with every scan and seeing that everything has just been progressing pretty normally, whatever that means, my anxiety's eased a lot. I'm so grateful that I'm in the spot where I can honestly say I love being pregnant. Like I really do. I thought that I would be more anxious throughout, but I do have a sense of calmness that I just keep feeling like it's going to be okay, and I love that because I didn't know how I would feel. That's not to say that I don't have those moments of anxiety. I do. Even now, I have a scan in a week, and I know that the day before I'll feel a little bit anxious and whatever. But now that I do feel him, I have that reassurance that okay, he's actually in there. So that's been nice. But overall, I'd say things are going well. Um,
You carry a lot of trauma from what you've experienced in the infertility journey into the pregnancy. And people don't realize before it happens to them that that trauma doesn't disappear just because you've succeeded. It's like a weight you've carried for months or years or however long it's taken. And it's not like suddenly you drop the weight because now you're pregnant. Now that trauma turns into anxiety, and it's anxiety about what's going to happen next. It's sometimes guilt that you succeeded when your friends didn't. It's sometimes concern about what if something goes wrong? Do I still have to, do I need to make more embryos again? And you're on pins and needles for 9 months. Like it's a hard place to be. Everybody thinks they're going for the success, but what they don't understand is the pregnancy management is every bit as important as the fertility management is. And that's why I love the fact that I still take care of my obstetrical patients, because I recognize that, and I try to help them through that process as a whole. Are you seeing an MFM, or are
I
you
am
seeing a regular OB?
I am seeing an MFM, but not for any reason other than that's the person that I was assigned to.
Okay.
Um, it started off a little bit of an interest. It was not our best first interaction when I saw her, when I told her about the IVF medication and everything that I was on. We had a strange interaction, but it's gone better every time that I've seen her, which I'm very grateful for. Um, and I did kind of voice to her early on that because of the trauma that I've gone through, I just, the way that what I kind of need is someone to just hold my hand a little bit more than say someone else who's just kind of, here's what's going on and this and that. I really do ask a lot of questions. I need a lot of reassurance. And that's because of what's happened. And after we had that big conversation, I feel like she was able to really understand, more so than at our initial meeting. So I was grateful for that. And things have gone better. So we're happy about that.
Yeah, and I think they're often not used to the fertility world, at least the way as I see it, because we do things differently for sure. And they're not used to that. They're expecting just a handover of, okay, they're off all their medications. They did estrogen, they did progesterone, now they're done, here you go. And when it's more sophisticated or more complicated, they actually have no experience with that. So they're like, wait a minute, this is different. And oftentimes it's very off-putting for the obstetricians or the MFMs. So it's great that you found someone that's got an open ear, because clearly I think everybody benefits from that, and you in particular, as you said, you benefit from having your questions answered, and I think that's integral to helping to alleviate the anxiety and the trauma for sure. So I know, was it last week or 2 weeks ago you had talked about induction of labor? I'm a huge advocate for inducing IVF patients. I do not believe they should go overdue. And every once in a while, I'm not going to lie, it's a very, very horribly guilty pleasure of mine to troll some of the posts where people are talking about delivering their 43-week babies and say, this is wildly unsafe. What are you doing?
Yeah.
And then it's so, to me, shocking how many people are horribly misinformed about the realities of delaying childbirth. And so when you mentioned it kind of just triggered all of that for me. And I thought I should probably help her out with this, because I know you mentioned people were like messaging you privately saying you're going to hurt your baby by delivering your baby early, right?
Yeah, that's the thing. I've had a lot of people have opinions about it, and I kind of knew, I've known for a while that induction would likely be the route that we would take on, and I was kind of tiptoeing around sharing that because, of course, I know people have opinions. And I will just say this, first of all, whatever method that someone chooses to birth their baby, I think is, up to them and their physician and whatever they're comfortable with. I don't think that I would never push for or say that one is better than the other. It's just, to me, it's you do you. Um, but yeah, I had some messages telling me, you know, that things can go bad, or just their stories about what happened that didn't go well and this and that. And I always think, why are you telling me these horrible stories? I don't understand how that's going to be helpful. And a lot of it, like you said, isn't true. And then I think some people just forget the reason, for me, the reason why I'm getting induced, I have a reason, a medical reason for being induced, which is the safest for me and babies. So I would love for you to chat more on that and kind of shed light on the realities of it. That would be great.
Online discussion about this, I decided to make a video, because when I asked the people who were saying that they should deliver their babies at 42 and 43 weeks and that it was safe for evidence, they were providing me with, books written by individuals who were not licensed to practice obstetrics and gynecology as obstetricians, gynecologists. And the data was all kind of anecdotal and not up to date. And so I was like, where are the trials for this? So I actually went and did all the research, and I looked it up on PubMed, and I pulled the articles and I read them, which is kind of my style for anything we do here. I'm always kind of delving into the science of it all. And then we made that video on YouTube. So the reality is there are several key components to this in my view. So one is, are there risks and benefits to doing the induction? And the reality from that is, yes, there are risks and there are benefits. The risk is negligible. There really isn't a substantial risk at all based on the best available evidence. And the benefits are reduced cesarean section risk by about 13%, a reduction in maternal ICU admission, a reduction in stillbirth, and a reduction in the chance that the baby goes to the neonatal intensive care unit, or NICU for short. So, when I looked at the risk benefit profile, I said, well, there's virtually no risk, and there are these huge benefits. So why would we not do this? And in the past, it's completely true that we actually believe that induction at 39 weeks increased your risk of cesarean. But the ARRIVE trial demonstrated that it actually reduces your chances of a cesarean. So we no longer need to worry about that. And I agree with you 100%. Every woman should be free to make her own choice about her mode of delivery, obviously based on a well-informed decision process. But the biggest thing people were worried about was, I don't want to necessarily end up with a cesarean section. And I totally respect that. I take great pride in the fact that I maintain a very low cesarean section rate. So in my own deliveries and practice, so it was important to me not to mess that up either. I want women to try and have their babies naturally. There are loads of benefits to that: allergy reductions for the babies, better immune system, better coping mechanisms, better bonding with mom, breast milk, all those things. So, I wouldn't support it if it wasn't beneficial in that regard. The next part that I think is really important is, how do patients feel about the induction? Is it as satisfying, or are they having a less positive experience? And so there's actually a great study done out of the UK where they compared thousands and thousands of women who had elective inductions versus those who had waited, and showed that there was no benefit to waiting. There is not a greater satisfaction in waiting and letting it happen naturally than there was from an induction of labor. So yes, of course, you're going to have people that have horror stories, but you see that on both sides. So, when I would get on these posts and talk about the fact that induction was safe, and then you would get the people saying, well, no, you shouldn't intervene, and women's bodies know what they're doing naturally, and they should be allowed to do whatever they want, and so on. Then you would get the people saying, yeah, I had an induction and it was a disaster, I had a terrible experience. And then you would get the other people who would come out and say, well, actually, I didn't get induced and I had a stillbirth. And so there are definitely risks associated with waiting. And so when you looked at the satisfaction rates were the same. And then my final thing is, well, what's the harm in waiting? Because, you could say there's no significant risks to doing an induction, but are there risks to waiting? And there are. And that the biggest risk is stillbirth. And is there a benefit to waiting? And the answer is none. Your baby's not going to be smarter. Your baby's not going to have a higher, income later in life. They're not better because they weigh more. They're not going to bond with you any better because you waited. Your placenta is biologically designed to conk out. And it does that pretty much starting around 39, 40 weeks. So when you're extending it past its longevity, its natural time, you're actually just risking a disaster with zero benefit. There is no advantage to waiting. So for me, that's why I'm a huge advocate of this for our IVF patients. And I offer it to all of my patients, of course, but in particular for our IVF ones, those patients have struggled to get here. They are carrying trauma. They're carrying 9 months of anxiety with them when they get to the end. And a disaster like a stillbirth or a bad delivery or an ICU or an NICU admission are all horrendous for anybody to cope with. There's no question. And to any mom who has gone through that, my heart goes out to you. Nothing but sympathy from me. But the reality for IVF patients is that it's an added blow on top of a long history of added blows. And it can sometimes be the straw that breaks the camel's back, that one trauma too many that breaks the patient. And so for me, when I look at it and I say there's no risks, there's huge advantages, satisfaction rates are equal, and we're preventing disasters from happening, I strongly feel that patients should be educated about that and then make their decision based on that information.
Mhm.
Is everybody going to have a vaginal delivery? No, of course not. I mean, the human body doesn't work that way. So are some of you going to end up with a cesarean? Yes, you are. But is it going to be safer? Of course it is. It's going to be safer. Are we going to have equivalent satisfaction? That's what the studies support. And are you going to avoid some very significant, potentially horrendous risks? You are. So
Mhm.
I don't know how that's with you, but I would love to hear your feedback.
I mean, I actually feel pretty comfortable. I feel very comfortable with the induction, to be honest. I've said that my plan is really no plan. You know, if we do need to end up having a C-section because it's safer, then let's do that. But the loose plan is the induction. I feel pretty good about it. And you know, as many as there are scary stories or people coming into my inbox and telling me that I shouldn't do this or I shouldn't do that, I also feel comfort in hearing, you know, studies. And also there are so many people who have told me exactly that and how they were satisfied, or, you know, they have had 2, 3 kids and then they compare their first, you know, vaginal birth without induction versus their induction, and they've said that they much preferred it. They liked the control of it too, the fact that they could go to the hospital, they knew when it was happening, and that's also given me great comfort in it. So I'm feeling pretty good about it. That might change, but for now I feel good. I think
Especially for someone like you who's a planner, it's nice to have that kind of fixed time
yeah.
and looking forward to an end goal, you know, a time when you know, okay, at this point I'm going to have my baby for sure.
Yeah, like this is when we're going, you know, we're going to be meeting with the anesthesiology team anyways. They're going to be answering questions that we have about that, which I love. And then there's not that moment of when is it going to happen? Is Curtis going to be home? Am I going to be okay? And there's all these things that, like I said, for me, my biggest anxiety is the unknown. So I do find comfort in having that as a set plan. Of course, things go a different way. It does, but to have that be the goal is comforting for sure.
That's awesome. Well, I really appreciate you sharing. I don't know if people have been asking questions or
Tons of
tons of
comments
questions and comments.
feedbacks. Yeah.
So why don't we let Tarek jump in here and he can fire off some questions. You're okay with that? As long as it's nothing too personal. And if you're not comfortable, by all means, let us know. We don't want you feeling like you're forced into this at
It's
all.
mostly a lot of feedback and you know just this great stuff like hey Sad, you look gorgeous. Hi Sabrina. You know, a lot of people are super excited to see you, Sabrina, it seems. Hi Sabrina. Um, Let me just go through all the comments that are for everybody here just to make it easy.
We should just get her to do the show from now.
Yeah, so some people said you know, OFC is the worst! Exclamation mark.
Oh.
A lot of everyone's sharing in the story, it seems. Um,
And this is, I want to tell everybody, I generally try to avoid naming clinics and stuff like that. And Sabrina, I appreciate the fact that you were very cautious about that as well. This isn't, we never planned this show as a method to bash any specific physicians. And I think in the 5 or 6 years we've been doing this, I don't think we've ever once
no,
mentioned even another clinic or
yeah,
doctor. So we try aggressively not to do that. This is not about clinic bashing at all. You know, you were talking earlier about advocating for yourself. We literally started this show because I realized patients were paying for double IUI, and double IUI is proven useless. And I was like, I need to tell people that this is useless because they're wasting their time and their money. And so we wanted to do this as a way to advocate for patients so that they didn't have to. So it's not about clinic bashing at all. Believe me, we could bash a lot of clinics, but we don't. And I never want it to be about that because I want everybody to do better. And we actually help patients who are going to other clinics so that they can do better wherever they are.
You don't have an ego, Dr. V, and are willing to tell your protocols. That's much different than most REs.
Yeah, for sure. Like I said, we freely share our protocols with people because we want them to do better.
Congratulations, Sabrina. Okay, I'm tearing up too now. I think the world of you both. Love this pair up. They asked for your Instagram account. They got it. They responded with IVF underscore baby underscore D. Thank you so much. Thank you. Thank you. Uh, uh,
Any questions?
oh yeah, there's a lot of questions. I'm just going through the things.
The comments.
Yeah. Oh, I swear they love saying that it's in your head.
Yeah, it is true. Like it's the go-to response for a lot of GYNs and family docs and as well fertility specialists. Like they just belittle the pain. It's like it's not important. As though all women are supposed to suffer through their period. They're not.
Yeah.
Dr. Singh is a miracle worker.
Yeah.
Um,
He is an amazing surgeon. He's very, very good. Yeah. And I can't take any credit for any part of that. I wish I could, but he learned it all in Australia. So
all of my babies were born no later than 38 weeks. Some people comment on that. Just here to say, love you, Sab.
you got a huge fan following. Like it's genuinely impressive. And we can say that, Tarek and I, because we kill ourselves for every follow. It takes a lot as a guy on IG to get followers on a very female dominated topic. And so, it's taken a lot of time to grow. And you've had this like amazing growth and you are very warm and engaging. And so I think that like that's incredible. We're really amazed to see how phenomenal your thing is. There is no question, hands down, the one where you got the positive, it is a huge tearjerker. So for the audience that's watching, if you have not seen it, go to Sabrina's Instagram page and watch that video because it is. If you walk away from that not tearing up, you're either on a lot of steroids or I don't know, you have no emotion or something. But yeah, it is definitely a tearjerker. It's super cute. Yeah.
Well spoken and great
It's
information
funny
as well.
because
Go
I
ahead,
was gonna
Sabrina.
say in the beginning of the video, you can tell Curtis is like, "Do you want to see it? Do you want to see it?" And I'm like, I can't. I need you to open it." And I just looked at his reaction to know kind of what the test was, and
Yeah.
yeah, I can't look at that video without crying myself. So.
Yeah, it's pretty awesome. And how's he coping with all of this? I should have asked you earlier.
Yeah, he's great. He's so excited. He still, of course, has the same anxieties as I do, going through different scans. We both get anxious, kind of going in, but he is just so excited, so thrilled. He actually, we have a name. We haven't announced it yet. We haven't told anyone except for the two of us. And it was him who thought of it after a 16-week appointment. So I'm just really excited to share it, but we'll have to wait till April.
That's awesome. Very, very cool.
That's all the
comments.
that's
Are,
up to this moment.
Are there any questions
There's a
for
lot of
Sabrina?
questions for Sabrina?
Yeah, or are they all medical questions for me? Because I don't want to keep her.
When I'm skimming through, I found Dr. Victory's page through Sabrina and learned through the lives what the best transfer protocol is for me. Thank you both so much.
Yeah, you have really guided a lot of people to better care. I think by advocating for yourself, as you said, and then getting the care that you wanted, I think a lot of people have been inspired to say, I don't need to get crappy care anymore. I can actually look around till I find good care wherever they may find that and advocate for themselves. And that is that I think it's super critical for you to know how empowering your journey has been for other people who and I've seen people from the US now coming to us and from all corners of Canada and even from the UK who have somehow been in touch with you or followed you and then found out about us through you and they feel empowered, like you've changed the trajectory of their fertility course. So, huge round of applause for you. That's a tough thing to do. As a fertility specialist, I have a tough time doing that. And you're on the patient end of things and are able to affect that. So, you deserve a huge amount of thanks and gratitude and appreciation from me as a fertility specialist for sure, but of course from the community out there as well. It's really a remarkable thing you've done.
Well, thank you. It means a lot.
For sure. I think we got to answer questions. Is that right?
That's
Yeah.
awesome.
Okay. Well, Sabrina, we've only got about 5 minutes to answer questions. So I want to thank you profoundly for joining us on the show. I took up way too much of your time. Definitely stay in touch and promise us you'll send us some pics of the little one when he's born so that we can share if you're comfortable with that. Or at least let us know how you're doing so that we can share that with everybody after it all goes down. And maybe we get you back and we find out what your induction felt like if you decide to go through with that versus a natural process or whatever ends up happening.
Yeah, that sounds great. Well, thank you so much. I enjoyed this talk.
Thank you. Have a great evening. We're going to take questions. Feel free to stay on if you'd like, but we're going to go to the question segment now and we'll go from there. So thank you again. Really, really appreciate your time.
Thanks.
I guess we can give people 15, 20 minutes for highlights. She's amazing, eh? Like literally people from all over the world just contacting me saying, I found out about you through, they call her Sabs too. Have you seen that? Yeah. So they call her Sabs and that people saying they found out about us through Sabs and, they're inspired by her. I mean, an amazing lady. Really. I have nothing but huge respect for her.
Question number one.
Okay. Out of like 5 million.
Oh yeah, for sure. Like
it's good. We're gonna need another show just to do
for the show's question.
Yeah,
absolutely. Hi, Dr. V. Wife had two FETs of untested embryos, 5AA and 4AA. Both did not implant.
Okay.
Our doctor wants to do ERA. We are staunchly against this.
Good.
Wife has had 2 children prior to me, also cesarean. Is PCOS women, how likely is it she has silent endo or adeno? Both of our FET protocols have modified natural FETs. Our doctor wants to do a fully medicated cycle with Lupron. What would you do?
Well, I'd test you first, and I'm sorry you're going through that. I would want to know what's wrong. In any scenario where I'm doing, an embryo transfer, I would want to know what's going on. You're at risk for an isthmusal, which is that cesarean scar defect if she's had 2 previous sections. That can frequently be the cause of failure. So it could be something simple like that. It could be more sophisticated if there's endo, adeno. Those are things we'd have to look for. I do not believe in torturing women with Lupron and letrozole, which is what's needed for endo and adeno, unless you actually know that they have endo and adeno. One thing I don't sugarcoat is the fact that giving women Lupron and letrozole for 3 months is horrible. Like it is genuinely horrible. My heart goes out to every patient I torture with that. I do feel bad about it. But the reality is that's what we need to do to get you to success. And so doing that to someone you don't know actually has endo and adeno, I have a tough time with that one. For me, it's a no-go. I just feel like it's extremely strong, aggressive therapy when you don't actually know what you're treating. So I'm a big believer in getting people answers. If I can get you answers and I can figure out what's wrong, well, then I can address it. So Fertility testing for your microbiome, immunological assessment for assessing the immune system to make sure there's no immune reactivity, or either overreactive or underreactive. All of these things can play a critical role. There are other things, some of them surgical, and then your general health, the quality of the embryos. Did one of you or both of you smoke? Were you using marijuana? What's your body mass index? Like there's a lot that goes into it. So it's a great question, but I would look for answers before I would look for treatments. And as a general rule, I don't think anyone should be getting treatments without answers.
I don't know what I'm doing.
Tarek, for those of you who don't know him yet, has wonderful facial expressions, which crack me up to no end. And one of them is the I give up facial expression, which he is currently giving me because it's 9 o'clock and we've answered one question so far.
That's basically, we got an hour worth of questions here.
Yeah. So let's take some highlight questions.
All right.
And then you know what we will do? I don't know. Where are you this weekend? Is this the weekend you're going? No, it's the next weekend you're going.
Yeah, I'm here.
We'll figure something out,
We'll get
guys.
to it.
We'll do another live or something.
Can a late ovulation cause a miscarriage?
A late ovulation can be associated with diminished egg quality. So it's not the late ovulation that's the problem, it's the quality of the egg that's the problem. And yes, if you have poor egg quality, that can lead to a miscarriage. You're just looking for.
I'm just going for, yeah. Hi, Dr. B. How do I get my prolactin down? It is 34 UG over L when I tested. I took the blood draw directly after a CrossFit workout. Would that have affected the results?
I don't know about the CrossFit workout. I wouldn't think so, but it has to be done between 8 and 9 in the morning. And I probably wouldn't do it after a CrossFit workout just in case it had some kind of impact. So prolactin has to be done between 8 and 9 in the morning because it has this diurnal variation. So it's important to do it at the right time. And then you need a prolactin and something called either a monomeric or a macroprolactin. So you can actually figure out what the true prolactin, the active prolactin level is. If it is elevated, it's easy to get down. You take Dostonex or bromocriptine.
What do you recommend for PCOS patients to try in having natural pregnancy?
So I have a three-pronged approach to PCOS. Number one, you need to do medications. So typically it's letrozole plus minus metformin if insulin resistance is a problem. Two, there's a natural approach. You should be doing supplements, vitamins, things like that. And then three, you need lifestyle changes. So 6 meals a day is critical for all PCO patients: breakfast, snack, lunch, snack, dinner, snack. And then on top of that, you need to have exercise. And the exercise has to be muscle building exercise. So we recommend you do all three of those. You got smiley face. Did something funny happen?
It's not that funny, but it's it's just something. $5 million or dinner with Jay-Z. Yeah.
That was someone's comment?
It's a busy show. I don't know. Yeah, a lot of.
That's the craziest thing anyone's ever said. Okay, wait. Let's answer the question. $5 million or dinner with Jay-Z?
Yeah, he's not going to give you enough knowledge to.
I don't care about Jay-Z one iota.
Million.
I would take the 5 million.
Jay-Z said take the 5 million.
I would take the 5 million. I'd probably give 25-30% to charity.
There you go.
And then I'd pay off debt. What would you do? Would you have dinner with Jay-Z or would you take the 5 million?
I just listened to his old albums. I'm like, this is as good as it gets.
Yeah.
There's nothing new going on.
Even if he brought Beyonce, I wouldn't pass up on 5 million. That's a funny comment.
She's overrated in my opinion.
This show gets wilder every week we do it.
Yeah. Any tips on what to consider when selecting sperm if using a donor sperm? Also, is it possible to use one's vial for more than one egg retrieval if doing ICSI, since you need less motile sperm for ICSI?
Yes, it is possible to use one vial for more than one, although keep in mind you're going to be thawing it, refreezing it, rethawing it, which is not great. It causes a lot of oxidative damage, but it is doable. From the standpoint of what to look for, I mean, aside from the personal characteristics of the individual who's provided the sperm, look for a high count, high motility, high number of normal forms if they're providing you with a report. I am not a believer in any kind of eugenics, but it would make sense to pick someone that has less genetic defects, just so there's no interaction with yours, and so that your kids don't have to be at risk of having their own offspring with genetic problems in a future relationship. And then look for someone that does not smoke, drink, or use drugs. And if they have body mass index, you want someone lighter, because men with obesity have poor quality sperm.
Induction question.
Oh yeah, bring it on.
Is 39 or 40 weeks better for IVF induction? My midwives told me 40 weeks, mostly because of my age, and she's 39.
No, 39 is better, no question. And that's actually been proven scientifically without a doubt in the ARRIVE trial. So your midwives, God bless them, because I do love the midwives, are not providing you with accurate information. Is not a question.
It's just over. It's just a lot going on here today. I don't know what's going on. With young donor eggs, want to transfer 5-day embryos, but my doctor says transferring 3-day has higher success. I'm not doing PGT testing, and I would rather wait until blast. What do you think?
I think your doctor's a quack. Like, no one anywhere is advocating for doing day 3 donor egg embryo transfers. That's absurd. I mean, no one would support that. And if they are, show me one study that shows that day 3 has a higher success than day 5. First of all, that's categorically untrue. It's actually the opposite. Day 5 is higher than day 3. And secondly, why would you not want to wait till day 5? You're selecting the best embryos. You're giving yourself the best chance. And we do know that more than 1/3 of donor egg embryos can be genetically abnormal. So you get the chance to do the PGT, which is actually prudent in donor egg cases. So whatever they told you, that's flat out wrong, demonstrably incorrect. I would happily challenge that physician to a debate. I'm getting messaged on my watch from people on Instagram while the show is going on.
That's a lot.
Yeah. Did we hit your target that you wanted? Did we go over that number? We didn't.
We didn't.
Oh, wow.
Yeah, I'm actually super surprised.
It could be because we've got TikTok on the.
Yeah.
That always messes it up.
It did actually.
Yeah, it does mess it
actually,
up.
100%.
Yeah, I know.
We're going to get lit treatment in Canada.
With us and with Tripod that I'm aware of. I don't know of anyone else that does it.
Oh, really?
I don't. I'm sure there are. I just don't know of any.
Let's go with just you.
I love Tripod. I'm not going to smash Tripod.
All right, Tripod and you.
Tripod I'm good with. Yeah.
What do you think?
I don't talk smack about other clinics.
Me neither.
But I will point out a good clinic when I see one. Tripod is a great clinic. So
Respect.
I got no trouble with that.
Respect.
Yeah.
What do you think about growth hormones for egg quality in poor responders?
Clearly demonstrated to be of benefit, and so we use it.
Soraya says, hello, I'm here.
Oh, hi, Soraya. How are you, dear? Sorry it took so long to acknowledge you.
A lot of people.
We got 5 more minutes.
Okay. In natural occurring twin pregnancies, what are the chances of having subsequent twin pregnancies?
If you've had one set of twin pregnancies, what's the chance of having a subsequent chance
My answer
of
is 0, but what do I know?
No, I've actually seen people that have done that. In a naturally occurring one, so that's 1 in 300. I guess it would be times 1 in 300 again. So 1 in 9,000?
90,000.
9 4 zeros.
Yeah.
90,000.
90,000.
Yeah. That's not high.
Not stacked for you.
Don't be buying any lottery tickets or anything.
Those are not the odds you want.
No.
What do you recommend for poor egg quality in a low AMH 6.2, no unit given?
Vitamins, acupuncture, healthy diet, exercise, low stress, a great IVF specialist. That's pretty much everything. No smoking, no
watching our
drinking.
show on a regular basis.
Watching our show on a regular basis.
Put a smile on your face.
Yeah, no smoking, drinking, drug use, meditation, yoga.
Hi, Dr. VNT. I'm currently trying naturally, and I'm taking aspirin prenatals with DHA and 12 milligrams of fish oils.
Great.
I heard this isn't a good mix, especially for someone with high NK cells. Thoughts?
No idea why they would say that. There's no harm from aspirin for NK. The fish oils should, through the PPAR gamma pathway, reduce your immune inflammation and NK cells. And the prenatal vitamin has no impact on your NK cells, to my knowledge. So I would love to see data that says that some part of that is detrimental. It isn't.
Hi, Dr. VNT. For a person who doesn't have endometriosis, adenomyosis, or blocked fallopian tubes, how and why would Lupron be indicated to help tame down inflammation?
It wouldn't. There is a Cochrane database meta-analysis that demonstrates that Lupron as part of a frozen embryo transfer cycle increased success rates across the board, not for endo patients, just for everybody. So there are benefits to using Lupron. I don't think they're anti-inflammatory benefits. They're probably just hormonal control benefits, but it is not beneficial from an anti-inflammatory standpoint if you don't have a hormonally mediated inflammatory condition like adeno or endo. So don't do it unless you have that, or you're just doing it to improve your FET success.
Last question.
Yeah.
Hello, my favorite doc.
Oh, awesome. Are they talking about you or me?
Love you, T. So I guess I am the love, and you're the favorite doc.
And I'm the favorite doc.
And I will go with the love.
You'll go with the love.
I will go with love.
Okay.
How long after stopping isotretinoin can I start an IVF cycle? Will it impact egg quality?
I think it's a couple of months off the top of my head. The half-life of isotretinoin is a while, so I think you need to wait at least like 3-4 months. I'd have to look that one up or talk to the pharmacy, but it's a while. Isotretinoin is a vitamin A derivative used for acne that is one of the few true teratogens where it can totally mutate what the baby looks like structurally.
Really?
Yeah. And affect organ development, so you cannot take it. That's why when they put girls on it for acne, it's an acne treatment. So when they put young women on it for acne treatment, they make them take the birth control pill.
Oh, wow.
Because you cannot get pregnant while you're on that
Really?
stuff. Yeah, it's a disaster.
Wow, I never knew that.
Yeah. Okay, I think we're going to wind it up.
All right.
We'll save the questions and we'll get to them on another show or something.
Okay.
Sabrina, if you're still watching, God bless you. Thank you so much for joining us tonight. Awesome show. I loved your input. Your insights were invaluable. And thank you for inspiring so many people to advocate for themselves. On my part as a physician, I feel terrible that any of you need to advocate for yourselves. That's why we have this show. But I am so proud and honored to have been a part of Sabrina's journey. And to have had a chance to at least try to make this work for them. So incredible story, incredibly inspiring person. And again, if you have not seen Sabrina's video where she gets her positive, you have to watch it. It is absolutely just heartwarming and inspiring and incredible to see. So have a lovely evening, guys. We will be back next week. And we'll see you then. Same bad channel, same bad time. Have a good night, guys. Lots of love. And we'll see you next week. Yes, please subscribe. Hit those like buttons. Subscribe, follow. Check us out on YouTube. We've got all our videos there.